Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, management of perforated peptic ulcer. So, whenever there is gastric ulcer perforation, so whenever there is peptic ulcer perforation, then how are you going to treat it? Okay. Whenever there is perforation of peptic ulcer, the patient will present with acute abdomen. Initially, see whether there is gastric ulcer perforation or whether there is duodenal ulcer perforation, the contents which are present in the stomach start appearing in the abdomen. So whenever there is stomach contents and secretions enter the abdomen, enter the peritoneum, they cause an inflammation in the peritoneum, which is called as peritoneal, that is chemical peritonitis will occur. So due to gastric and duodenal secretions will result in chemical peritonitis. Okay, and first initially there is chemical peritonitis. Later, within hours of time, this chemical peritonitis will progress to bacterial peritonitis, because within hours there is, because of this, the chemical peritonitis, the bacteria will enter the bacteria which is present in the duodenum or in the gut will enter the peritoneal cavity, and it will cause bacterial peritonitis. Within hours, bacterial peritonitis will occur. Now, because of this peritonitis, the fluid will enter into the inflamed peritoneum. So, as a result, the patient will develop fluid sequestration into the third space of inflamed peritoneum. Into the inflamed peritoneum, fluid sequestration will develop in the patient. Okay. Now, because of this, the patient will develop peritoneal signs will develop in the patient, and there is marked guarding and rebound tenderness is seen because of this. Because of this peritonitis, the patient will present with marked involuntary guarding and rebound tenderness are seen in the patient. Now, how are you going to diagnose this condition? So, for the diagnosis of this patient, we have to get a chest x-ray done. Upright chest x-ray. When you do an upright chest x-ray, you will see presence of free air is found below the diaphragm. Whenever there is free air present below the diaphragm, it is positive for a perforated peptic ulcer. So whenever below the diaphragm, whenever there is presence of free air, then this will state that the peptic ulcer is perforated. Okay. So this is important points about perforated peptic ulcer, that is pathogenesis and diagnosis.
thank you and thank you for watching.